to go ahead and start, and it is 3:01. Hopefully we'll have some more people coming in, and they are starting to come in now, so that is awesome. Just want to say I hope everyone is having a great day. I'm Lynette, and welcome. And I just want to say we are excited about our Zoom platform. This is, again, something that we have pivoted to in lieu of everything that is going on, and we're pretty excited. So again, I'm Lynette. Go back one second, Dale, thank you. I'm the Director for Community Engagement, and I want to welcome you to our Forum for Cancer Awareness. Next slide. So before we begin, I want to give a special shout out to our sponsor for today, NovaCure. And for those who are not very familiar with NovaCure, it's an international oncology company, and they have been doing research for over 19 years and have made significant strides in their work and their efforts. NovaCure is an innovator in the field of oncology and is dedicated to improving the lives of cancer patients, which of course that is what we are totally focused on today, and we appreciate their support for helping us deliver this cancer awareness education platform. Next slide.
I'm having some problems.
There we go. All right. And again, welcome to all of you. I do see more people have joined. Thank you for joining. Just want to let you know that today's session is presented by Advocates for Community Wellness. We are a 501(c) not-for-profit organization. The nice thing about our organization and the way it was founded by our leader, Dale Kane, is it's grassroots. So we go out, we're in the community, we provide support on all different angles. Our mission, when you really sum it up, is to promote wellness, vitality, longevity through education, through lifestyle changes, fitness, proper nutrition, because we all know it's all about what we eat, and also the support systems that we have, but also raising the awareness. Today we're raising awareness for cancer, but there are many dimensions of our organization, and that includes mental health and also serving the populations that are categorized as underserved. And we also really focus on multiple chronic illnesses to understand how we can prevent and also manage them. Next slide, please.
I'm sorry. I'm having some problems on my end.
This is our leadership team. I'm Lynette, and you have Dale Kane. Again, she is our founder and executive director, and Miss Regina Hopkins, she's our health education director. She is who will be delivering the great presentation today, and I am very excited to introduce Regina to you. Regina has a very extensive background in the medical industry. She has over 13 years. She is a certified nurse practitioner, and she does a lot of work on the south side of Chicago. Miss Regina has traveled across the globe, and she is also an author, which you'll get a glimpse of her books that she has published. She is also the founder of an organization, RISE, which is acronym for Respect, Influence, Success, and Empowerment. So you put all those things together, and that's a powerful lady. And the one thing that I really personally enjoy about listening to Regina is that she is very knowledgeable and also presents things with clarity, but in a way that we can all understand. I also want to make a special mention that later on in our presentation, we do have 2 community partners who I will introduce later and allow them to have the platform as well. So again, welcome everybody. If you can, while you're listening, if you could send a quick introduction to your friends on Facebook, and they can join us as well. All right. I'm ready for you to start, Regina. Thank you.
Thank you so much, Lynette, for that wonderful introduction. Well, hello, everyone. As Lynette stated, my name is Regina Hopkins. I am a family nurse practitioner serving on the south side of Chicago. I have a master's degree in nursing science with over 14 years of medical experience in the medical field. My focus is chronic disease management. I do a lot of patients with chronic diseases who I manage in a clinical setting. I've also traveled to Bangkok, Thailand in 2005, completing research in women's health. And I am the author of 2 published books, Growing Grace, which is a 30-day devotional, and SALT, which stands for Sisters Accelerating Lives Together. Next slide. Okay. So the presentation that we're going to be giving today really focus on cancer awareness. As Lynette stated earlier, we want to thank our sponsor, NovaCure, who partnered with us to be able to do this presentation to give out more information on cancer awareness, and also with the hope of encouraging individuals to get the recommended cancer screenings. As we know, early detection of cancer saves lives. So we want to really push that information out, push the word out to encourage people to be aware of the risk factors of certain cancers, also know the types of cancers they should be screened for on a routine basis. So just to start, just to get some information on cancer in general, many people may ask, what is cancer? Well, what is cancer? Well, cancer is the name given to a collection of related diseases. In all types of cancer, some of the body's cells begin to divide without stopping, and they spread to surrounding tissues. When cancer develops, cells become more and more abnormal. Old or damaged cells survive when they should die off, and new cells form when they shouldn't form. These extra cells that form and divide without stopping can form growths and tumors that can lead to cancer. Next slide. Just a few facts and stats. I do like to bring in statistics when I'm doing presentations. The majority of individuals that we do our presentations with are those in the underserved community. So we see a lot of the African American and Hispanic populations that we service. Could you go back, please? So just a few statistics. And these stats were taken from some research studies that I had pulled up. African Americans have the highest mortality rate of any racial or ethnic group for all cancers combined, for the majority of cancers. The death rates for all major cancers are higher for African Americans than whites, contributing in part to a lower life expectancy for both African American men and African American women. About 202,000 new cancer cases and 73,000 cancer deaths were expected to occur among African Americans in 2019. African Americans have the highest death rate and the shortest survival rate of any racial and ethnic group in the US for cancers. And those are pretty scary statistics. They're real, but they are pretty scary. Next slide. So when we talk about cancer, we like to talk about risk factors. Like I mentioned before, we are going to be giving a lot of information on cancer awareness. We're going to go through several types of cancers and the recommended screenings, but let's talk about some potential risk factors. And a risk factor is anything that can potentially increase your chances of getting an illness or disease. So for just cancer in general, some potential risk factors are age, and we're going to kind of break down each of these as we go through the further slides when we talk about the separate cancers. But we can look at age. If you're a certain age, you're at a risk for certain cancers. If you have a high consumption of alcohol, chronic inflammation is also tied to certain cancers, and we're going to discuss what the role that inflammation plays a little bit later. Diet, environmental chemicals, things that are around us that we aren't aware of, that we're breathing and taking into our bodies. Radiation exposure, viruses such as your HPV, your EBV, which is the Epstein-Barr virus, HIV, HSV, which is your herpes virus, hepatitis B and C, Hormones, especially estrogen. We're going to talk about the role that estrogen plays in some cancers, especially breast cancer, a little bit later on. The immunocompromised, those individuals who have a compromised immune system who can't fight off infections and diseases quickly. Obesity. Obesity is a big one, and most people tend to, when we do these presentations, they're kind of shocked when they see obesity on the list. And if you look next to obesity on the opposite side, you see chronic inflammation. And these two do go hand in hand because what studies have found is that when people are obese, you tend to carry extra adipose tissue, extra fat cells. And what fat cells generally do is they take up space. When they take up space, they leave less room for oxygenated blood flow. And what happens is the space that is taken up from the extra amount of adipose tissue or the fat cells, they create inflammation. And in turn, what inflammation does, if you have anything that's inflamed, your body's going to react to it. So when you have chronic inflammation in your body, that can definitely affect the cell's structure. It affects the cell structure. It also affects the cell's shape. And it can also cause mutations to the DNA of the cell. And as we mentioned earlier, changes in the cell structure and changes in the cell cause the cells to act abnormally. And that will lead to abnormal growths into cancer. Also, sunlight, that's linked to certain skin cancers. Tobacco use, we've known for years that smoking can increase your chances of leading to lung cancer, and also the radio frequency waves as well. Next slide. So signs and symptoms of cancers, and these are just general signs and symptoms, but these are some symptoms that sometimes people tend to overlook and not really think about because they think it could be related to other things. But definitely breast changes, that's the first sign we encourage women to report. They have breast changes, changes in the breast, changes in the nipple. If any discharge comes from the breast, the discoloration of the breast, we get concerned about breast cancers. If you feel lumps or bumps in your breast that weren't there before, that's a sign that you want to get it checked out. Bladder changes, having trouble urinating or pain with urination, blood in the urine. These are things to be thinking about certain bladder cancers. Also, bruising easily or bleeding easily. And those are some of your blood cancers like your lymphomas and your leukemias. Additional symptoms, bowel changes, blood in the stools. You want to think about colon cancer, pelvic pain, problems urinating. You want to think about some of the cervical cancers or some type of gynae-related cancer. A cough that won't go away or voice changes. You want to think about lung cancer. Belly pain, nausea, vomiting. That can also be linked to certain GI cancers, especially colon cancers. Eating problems. Some people tend to say that they have problems eating where they eat a certain meal and they get full pretty quickly. We want to think about possible growths and tumors in the stomach, leading to stomach cancers. Pain after eating, trouble swallowing, weight loss. Weight loss is a really big one. Usually when people begin to lose weight, they get concerned. If you haven't made diet changes, you're not really exercising, you want to know, why am I dropping weight? Appetite changes, and fatigue that's severe that doesn't go away. Okay. So as we're bringing awareness, we want to touch on breast cancer, we want to touch on colon cancer, we want to touch on cervical cancer, lung cancer, and prostate cancer. And it is our hope that as you're listening to this presentation, we're hoping that you're going to be able to take away a lot of good information that not only you can apply in your own life, but we want you to be able to share this information as well. Because knowledge is power, and we do want you to share what you know. So the more that you're able to share the awareness of these cancer screenings, we're able to definitely promote cancer awareness and hopefully impact and save lives, because once again, early screenings and early detections can save lives. So let's look at breast cancer. And for each of the cancers, we're going to talk about certain risk factors and the appropriate screenings. And as we're doing this presentation, if you fit the criteria, especially the age criteria for the screenings, I want you to just kind of take a mental note and a personal note to determine, had you had your recommended annual screening, for this year, or have you had it in general? I know there's been a lot of delays and treatment and screenings, with the COVID-19 and how it has impacted individuals. But thankfully, there are a lot of facilities that are slowly opening up so people can still get their recommended screenings as needed. So if you haven't had these screenings that we're going to discuss today, I would definitely encourage you to speak to your healthcare provider to make sure that you are on track and making sure that you get your appropriate screenings. So breast cancer, what are some of the risk factors for breast cancer? Number one, obesity. Like we mentioned before, obesity, that extra adipose tissue, begins to create inflammation. Inflammation in the body leads to changes in the cell structure, the DNA, which causes mutations, which can lead to tumors. But the other key thing to note about obesity is when you have extra adipose tissue, which is the medical term for fat cells secrete estrogen. Yes, if you didn't know, adipose tissue, fat cells does produce estrogen. And what does estrogen produce? Estrogen is a natural hormone that occurs in the body. For women, it's responsible for, helping with our cycles, those who are still getting periods. And also, it also creates breast tissue. But when you have extra estrogen in your body, lots of amounts of estrogen, that can lead to an overgrowth of cells in the breast, which turns to breast cancer. So that's the link between obesity, inflammation, and estrogen. Estrogen, high amounts of estrogen in the body has been linked to breast cancer. So we're going to talk about ways to reduce the risk later, but one of the risk factors for breast cancer is obesity. Alcohol consumption is another one. For those women who've never been pregnant or never breastfed before, once again, the link between those two things is estrogen. If you have not been pregnant or have never breastfed, what happens is, if you're not pregnant, what happens? You're still getting your period. Every month when you have a cycle, your body releases estrogen. So the concept is the more estrogen your body is exposed to, the higher your chances are for possible breast cancer. So if you are pregnant, you don't get a period, you go those 10 plus months without getting a cycle, your body isn't producing as much estrogen. Or if you are breastfeeding, a lot of women begin to have their cycles delayed. When the plus side of that is you're not getting a period. And once again, you're not producing, or your body's not exposed to that extra estrogen. So those are the two links to breast cancer when it comes to never been pregnant or never breastfed before. Birth control pills. I know this is a shocker for a lot of my patients when I speak to them and educate them on birth control, contraceptive management, those who do want to use that as a form of birth control pills. You also need to know that birth control pills have a man-made form of estrogen in it. So once again, going back to the estrogen component, the extra estrogen in your body can lead to breast cancer. So if you have someone or you know someone who takes birth control pills, that's something that they should be aware of, that you're putting extra estrogen in your body, although the purpose of it is to delay a pregnancy or to prevent a pregnancy. Just know that it does come with a risk. And the same goes for women who take hormonal therapy after menopause. You get those hot flashes, you get the mood swings. Most of the gynaes like to prescribe estrogen, but many times they do counsel patients on the risk factor in terms of having a higher risk of breast cancer if they are exposed. And then lastly, family history. So if you have genetics also plays a part as well when we talk about breast cancer. If you have multiple women in your family who've had breast cancer, you definitely want to keep that on your radar because you yourself could be at risk basically from genetics, okay? So let's look at some of the screenings. The screenings for breast cancer. We encourage women at the age of 21 to start doing self-breast exams. So they're not getting any diagnostic screening or any testing done, but you do want to get into the habit at 21 to start feeling, doing self-breast exams just to kind of get an idea of how your breasts feel on a regular basis. Now, during the month, you can have hormonal changes, so your breast can feel a little lumpy during certain times of the month. But generally, after your cycle is over a couple of weeks later, those hormone levels begin to go down. You may not feel that bumpiness or that tenderness anymore. But if you get into the habit of doing self-breast exams, you know how your body feels and you know your body. So if you feel anything abnormal, that's a warning sign. A new lump, a new bump, changes to the nipple, your breast just don't look the same. You want to get into your healthcare provider to get an exam to determine if you need further testing. Then we have the diagnostic screening, the mammograms. Mammogram screening starts at age 40 to 75. So any woman out there who's on this Zoom call, if you're over the age of 40, up until 75, if you have not had your annual mammogram this year, and because I know the COVID has been going on and has delayed a lot of things for individuals, with this pandemic that we are experiencing, I still encourage you to still contact your healthcare provider to see, is it possible for you to get your annual screening? Now, for the sake of time, I have a lot of stories that I would like to share, but I won't be able to. But I can tell you for every type of cancer I'm going to discuss, I've had a patient who dealt with the cancer, and I've had the ability of diagnosing the patient with that cancer. Some of the stories have a happy ending to it, meaning they got screened early. Some of them don't. I just want to briefly share about the breast cancer screening, because I find also that a lot of times when I share stories, it does encourage people to really take action. I had a patient, had two patients, and both had two different outcomes. The first patient was a patient who came to me. She was in her mid-40s, new patient. She had never had a mammogram before. So as I'm going through her health history and, doing all the different things I do in terms of, screening my new patients, I asked her about her last mammogram, and she tells me, she's never had one. I asked her why, and her response was, well, I feel fine. And I find a lot of patients say that when I ask about certain cancer screenings. I feel fine, I feel fine. I don't think nothing's wrong. But I feel fine should not be a reason why you shouldn't get the appropriate screenings, because once again, early detection can save lives. So I encouraged her and pushed her. I said, well, if you're going to be my patient, I strongly urge you to get the appropriate screening. You're in your mid-40s now. You're about 5 years overdue for your mammogram. Here's the referral. Please get the screening. A week later, she goes to get the screening, and I get a call from the radiologist. Anytime I send a patient to get a test done, and if the radiologist calls me, that's not a good sign. Long story short, luckily for her, there was a lump that was found. We did biopsy it. It was positive for cancer. It was in the early stages, so they were able to do a surgery to remove it, give her some radiation, chemo treatment, and it's been 5 years and she's cancer-free. That was a blessing. Early detection saved her life. But I have a second patient whose story didn't end that way. Another patient, she was in her early 50s. Once again, had never had a breast cancer screening. And I had known this patient for about 3 years. She would come maybe twice a year to see me for different things. And each time I would encourage her and practically in some cases beg her, Mrs. So-and-so, did you get your mammogram this year? Oh no, I was busy and I was doing this and doing that and I didn't get it done. I give her the second referral. Come back several months later. Did you get the mammogram? No, I just didn't have time to do it. Third time comes back, did you get the mammogram? No, and at that point I kind of realized that she had a fear of getting it done. And she confessed to me that she was scared of having the test done. So, we had a discussion, gave her the talk. She told me that, she was going to get it done, after that discussion. About the fourth time I saw her, she came into the office, she was in tears. Her breast had swollen up. It was hard as a rock. She had discoloration to her arm. She had nipple changes. She had classic symptoms of metastatic breast cancer. And I told her, I said, you really need to get this mammogram. And I told her, I said, I strongly believe, at this point, you have breast cancer, but we need to get the test done. And, she told me, she said, you know what, I'm going to go today. I'm going to get it done. I'm going to take a family member with me. I'm going to get the test done. 3 months later goes by. I kept calling and calling and calling her and calling the hospital to see if the test was done. They're telling me no test was done. She walks into my office, with a family member. and asked me for a referral. And I said, what do you need a referral for? And she says, I need to see the oncologist. I said, so you finally went and got the mammogram? She says, no, I had an accident. And on the accident, they did a CT scan because I had a chest contusion. And that's how they picked it up. So she was in an advanced stage, and unfortunately, she was sent to hospice. So I say that to say, we're bringing awareness to cancer. We're encouraging the screenings because once again, early detection can save a life. So just getting back to the breast cancer screenings, like I said, the mammogram starting at age 40. If you have not had one, please see your healthcare provider to get that screening done. Also, too, if you have a strong family history of breast cancer, multiple women in your family, there's also a genetic test, the BRCA1 and the BRCA2. You can be eligible based upon a screening questionnaire to get a blood test to determine if you have those potential cells that can lead to breast cancer. And the last one for women who may not meet the age of screening for breast cancer at the age of 40. Also know that they're screening breast ultrasound. So if someone tells you you're too young to get a mammogram, you have concerns, don't let them push you away because you can be covered under a screening breast ultrasound that can still pick up abnormalities in the breast tissue. Next slide. Okay. So the next cancer we're going to look at is colon cancer. Risk factors for colon cancer is age. As you get older, body changes. Once again, we see obesity there. Obesity is linked to a lot of cancers because of that chronic inflammation. Family history, smoking, race. Studies have shown that African Americans have a higher rate of getting colon cancer. Also, diet, processed foods and certain meats. A lot of the processed foods, like your deli meats, your sausages, your sandwich meats, anything that you buy off the shelf, the meats that are packaged up, they have a chemical called nitrites, and nitrites have been linked to colon cancer. The recommended screenings for colon cancer starting at age 45. Now, about 3 years ago, the screening starting age for cancer was the age of 50. However, studies have shown that people are getting cancer much sooner than the age of 50. Actually, there's people in their 30s are getting cancer. So colon cancer has now moved from the older adult potential cancer. So now our younger population are experiencing colon cancer. So they've decreased the screening age for colon cancer to 45. So the screening test for colon cancer, if you are in that category, 45 to 75 years old, you want to get screened. There are several different ways to get screened, but there is one test I call the gold standard. There's a stool kit called the fecal occult blood test. Pretty much you just take a stool sample, the lab checks it for blood. If it's negative, they tell you you're fine. If you have traces of blood, they want you to do an additional test. You have a sigmoidoscopy, which is like a tube similar to the colonoscopy, where they go into the sigmoid of the colon to look for colon cancer. And you also have the colonoscopy. I consider that the gold standard because what the colonoscopy does, it looks throughout the entire colon and checks for cancer. And even if they don't find cancer, that's fine. But a lot of times when they do the colonoscopy, they do find these things called polyps. And polyps are abnormal growths that can potentially lead to cancer. Now, I call this the gold standard simply because if you get the colonoscopy and you do have that growth in your colon, they will take it out right then and there, biopsy it, and remove it. So that growth that could be there can't always be picked up on the stool test. So if you're given the option of doing the stool test versus the colonoscopy, a lot of people are scared because the thought of, going to sleep and having someone stick a tube up your rectum is pretty scary. But once again, I consider this the gold standard because they can find things on the colonoscopy that a stool test can't. And if they do pick up those growths, those polyps, those things can be taken out and removed. Next slide. Okay, let's move on to the cervical and endometrial cancer. Some of the risk factors for cervical and endometrial cancer are HPV and DES. And we don't hear a lot about these two cancers. Most people, aren't aware of, especially the endometrial cancer. They don't hear a lot about it, but that is one that I've seen quite a bit in my office. A lot of my older patients I've seen come in with endometrial cancer. But HPV exposure. So HPV stands for human papillomavirus. And as we mentioned before earlier in the previous slides, we talked about certain viruses that can lead to cancer. And some people may say, well, how can a virus cause cancer? Well, what happens is when a virus enters your body, it causes an infection. That infection spreads their DNA because a virus does carry its own DNA. That DNA begins to break down healthy cells and the genetic makeup of your healthy cells and potentially turn those healthy cells, which mutates them, into cancer cells. So that's what viruses do. They come in, they invade, they take over, and they set up shop and they replicate. So those virus cells will turn the good cells into bad cells, pretty much. And DES, if you have not ever heard of DES, one second, that is a hormone that was very common back in the 1930s to the 1970s, and it stands for diethylstilbestrol. It's a man-made synthetic form of estrogen that were given to women between 1938 to 1971. And it was thought at the time to help women who were having premature deliveries and miscarriages. They thought that if they helped women get more estrogen in their body, that they could carry the fetus longer. But some later studies showed, as we spoke about earlier, that extra estrogen in your body can lead to certain cancers. Not only extra estrogen leading to breast cancer, but they were also linking that to some cervical endometrial cancers. In addition to that, smoking, early sexual activity, and a weakened immune system. And just going back to the HPV, as I mentioned before, it was called human papillomavirus. For those who don't know what that is, it is an STD. It's a sexually transmitted disease. You only get it through having sex. We generally start screening women for cervical cancer via Pap smear at 21. But once again, if you've had sex at an earlier age, you could have been exposed to HPV at an earlier age. Endometrial cancers, obesity, postmenopausal, diabetes, and hormonal therapy. Now, some of the symptoms of both of these cancers will be pelvic pain, an abnormal discharge. And I want to point out in particular endometrial cancer, because like I said before, I've been seeing a lot of that in my older female population. Women who have hit menopause, if you're on this call, listen up. Once you're in menopause, generally means you've gone 12 consecutive months without a period. There's no spotting, no bleeding at all. If you've gone 12 months with no cycle, no period, you are in menopause. If for some reason, after 12 months of not having any blood flow, any period, you see a speck of blood spotting, that is a warning sign for endometrial cancer, okay? Just a very, very quick story. I've had a couple of women, both of them turned out to be the same situation. They were one was in her late 50s, one was in her early 60s. Came into the office, had complained about spotting. And both of them said, you know what, I got my period back. I said, well, that's not possible because you're in menopause. And I urged both of them, if you're having spotting after menopause, you need to see a gynecologist and we need to do a pelvic ultrasound, okay? Both situations, both were given referrals, both were told how urgent it was to get the testing done, both delayed testing for months. One was over 6 months, one was over a year. Finally, after getting both tests completed, both tests came back positive, showing hyperplasia of the endometrium, meaning there's a thickened lining of the endometrium, okay? Which what happened was because the lining of the endometrium, which is the lining inside the uterus, was so thick, it began to shed, which causes the bleeding. That is a sign of endometrial cancer. Both patients eventually, although it was late after they were urged to get the screenings done, both patients were sent to the gynecologist. Both had a biopsy done. Both biopsies were positive. Unfortunately, one of my patients did pass, despite having chemo and a total hysterectomy and all that, she did pass about maybe 8 months later. And the second patient is a potential hospice patient. Once again, early detection, early screenings can save lives. The screenings for cervical cancer is a pap smear. It can be performed once every 1 to 3 years. Women 21 to 65, you're sexually active, you should have a pap smear done. If you are in menopause and you've had that spotting, I don't care if it's a speck of blood that you saw, contact your healthcare provider. You should get a pelvic ultrasound or an endometrial biopsy to get screened for endometrial cancer. Next slide. Okay, lung cancer. Risk factors for lung cancer. We know that smoking causes lung cancer. It says it on a pack of cigarettes if you are a smoker. The Surgeon General warns you about smoking. Cigarette smoking, cigar smoking, pipe smoking. That smoking nicotine gets into your lung, makes cell changes, leads to tumor growths and lung cancer. Also, secondhand smoke. The scary thing is you may not be a smoker, but you have smokers around you. I know we did a cancer awareness workshop, I believe it was last year, and we had one of the participants who was on our panel who spoke about her developing lung cancer. She had never smoked, but her husband did, and she had that cough that wouldn't go away. And after getting the appropriate testing done, it was found out that she had lung cancer. So know that you're not only harming yourself when you smoke, but you're also harming, potential family members around you, because secondhand smoke can also lead to lung cancer as well, okay? Family history, HIV infection, immunocompromised, environmental risk factors, if you've been exposed to asbestos, radon, polluted air, inhaling those chemicals gets into your lungs, can lead to lung cancer, okay? And the screening, there are screenings for lung cancer, believe it or not, starting at the age of 55 to 75. If you've had a history of smoking, there's a screening that's paid for by your insurance. If you're 55 to 75 and you have a history of smoking, it's called a low-dose CT scan, where they use a low-dose radiation on the CT to pick up certain cancers. Or if you're under the age of 55 and you're having symptoms, coughing, shortness of breath, that nagging cough that doesn't go away, you can get a chest x-ray to get screened for lung cancer. Okay, next slide. Next, so guys, listen up. This is specifically for you, all my older gentlemen, 40 and up, prostate cancer. There's a screening for you. I know we talk a lot about breast cancer and cervical cancer and endometrial cancer. A lot of times people think that most of the cancers are geared towards women, but prostate cancer is for the men. So risk factors: age, race, family history, and also a diet low in folic acid. There have been some studies that stated that individuals who've had low folic acid levels were at potential risk of developing prostate cancer. Some of the potential symptoms of prostate cancer, some of them can be very vague, but for most men, they have trouble urinating, they have a weak stream, they go to the bathroom and not a whole lot of urine comes out. Some of them develop lower back pain. Some of them even complain about blood in their urine. And we talked about some of those symptoms early on in the previous screens. But the screening for prostate cancer for men, starting at age 40 and up, there's 2 ways to do prostate cancer screening. There's a blood test called a PSA. It checks for these cancer cells in the blood. If those levels are elevated, they do send you to have a biopsy to check for cancer. And also the digital rectal exam. Now, I have found that most of my male patients, when I talk about prostate cancer, they immediately say, well, no, they don't want to get screened, because all they know is the digital rectal exam, the finger that goes into the rectum, the press on the prostate to see if it's hard or tender. And just the idea of having that done, they're like, nope, you're not doing that to me, doc. I'm not going to have you sticking no fingers anywhere. But, I do encourage them, okay, I don't have to do that test, but let me do the blood test. A lot of them, of course, they're more agreeable to the blood test. So if you did not know, guys, 40 and over, that there's another screening apart from that rectal exam, you can get a blood test. So please don't be discouraged from getting prostate cancer screening because you're afraid of having a rectal exam, a digital rectal exam. So there is a blood test that can also pick up prostate cancer. Unfortunately, if it is positive, there's additional tests that you do, such as a biopsy, where they take tissue pieces from the prostate to determine if you have cancer or not. Okay, next slide. Okay, we're getting to the home stretch, and I hope everybody's still awake, okay? So it's a lot of information, and we try to condense it all into 40 minutes, but I can go on and on because I have a lot of stories that I do like to tell when I do this presentation, but for the sake of time, I won't be able to tell all the stories because for every cancer, like I said, I have several stories of patients for every different cancer that I've just mentioned. Some of the stories turn out to be good, some of them not so good, but how can we reduce our risk for cancer in general? First thing, get the regular cancer screening test. So we talked about breast cancer, the mammogram, colon cancer, the colonoscopy, cervical cancer, the pap smear, endometrial cancer if you have those symptoms, the pelvic ultrasound or the endometrial biopsy. Prostate cancer, it's a blood test, or lung cancer if you fit the age requirement to get the low-dose CT scan. So there are ways to get screened for these cancers. Once again, as I've said before, early detection saves lives, okay? So regular screenings can catch some cancers early when they're small and they have not spread. So those that are caught earlier are easier to treat, okay? We have some kids on the line. The other thing is get to and stay at a healthy weight. We saw obesity was a streaming risk factor for a lot of the cancers because like I mentioned before, obesity creates chronic inflammation. Inflammation changes the cell structure, causes mutations to the cell, which creates overgrowth of cells, which can lead to cancer. So get into a healthy weight, okay? And with advocates, we are very big on promoting, healthy diet and exercise and nutrition. Exercising on a regular basis, I encourage my patients try to get at least 30 minutes of exercise in at least 4 times a week, okay? So getting active. Eating a healthy diet. We're going to talk about some healthy foods a little bit later on. Avoiding tobacco, stop and cutting back on smoking. Limiting your alcohol. And also a big one is adequate vitamin intake, okay? So if you don't know, vitamin D is a very, very important vitamin. And a lot of people are deficient in vitamin D, okay? What vitamin D does, it helps to boost and build your immune system. Not only does vitamin D protect your bones and build your bones to prevent osteoporosis, but it helps to build a strong immune system. And also we know if you have a strong immune system, you're able to fight off certain infections much easier. And also a healthier and strong immune system can also decrease your risk of getting certain cancers, okay? So that's the important thing to note, getting adequate vitamin D, okay? Next slide. Okay. 7 cancer prevention tips in your kitchen. So the first, eating food, of course, but you want to make healthy food options. There's a big emphasis now on the plant-based diet. And if you follow us with advocates, Dale is very, very big on promoting the plant-based diet. But there's a lot of benefits to the plant-based diet. She got her thumbs up. So there's a lot of benefits, and research has shown that eating a plant-based diet, not consuming dairy products or meat, because of course we know that they're pumped with a lot of hormones and certain chemicals that we probably can't even know the list of because there's probably so many of them. But plant-based diet has been shown to have a lot of good effects on individuals who are able to decrease certain chronic diseases. And also they've been, there's some studies to say that they're helping to reduce risk for cancer. We talked about avoiding those processed foods, those deli meats, those sausages, those hot dogs and things that are processed. They have a chemical called nitrites, and nitrites have been linked to colon cancer. Reducing your sugar intake, extra sugar in your body can lead to extra fat. We talked about extra adipose tissue, leading to chronic inflammation. Eating meat in moderation, finding your healthy weight and staying there. Eating plenty of anti-inflammatory foods. We're going to give you a few foods in a couple of minutes, and also limiting your alcohol consumption. Next slide. Okay. So choosing the right foods. Broccoli, carrots, berries, beans, cinnamon, olive oil, turmeric, flaxseed, tomatoes, garlic. All these foods are known to have cancer-fighting properties. So if you don't have any of these foods in stock in your refrigerator, I would encourage you to take note of this list and, maybe incorporate some of these things into your diet, because they do have a lot of antioxidants in them and a lot of properties in them to help to fight cancer. Avoiding processed meats, okay? Processed meats, like I said before, your hot dogs, your bacon, any meat that you find at the deli counter, they have lots and lots of nitrites. Nitrites are used as preservatives. But there are studies shown several years ago, they came out with reports stating that we know now there's a link between nitrites and cancer, especially colon cancer. So limiting those processed meats. Limit or avoid red meat. So red meat is also linked to some cancers. So you want to aim for at least or less than 12 ounces of cooked red meat per week. And instead, you can choose lean chicken, fish, or plant-based protein. You don't always have to eat meat to get your protein source. Avoiding alcohol. Women should have no more than 1 serving per day. Men no more than 2 servings per day. If I say if you can avoid it at all, then don't drink any at all. Okay. Next slide. Okay. So these are just a couple of resources and references that I use to get a lot of the information that I spoke to you about today. Cancer.org, MayoClinic.org, and of course the CDC.org. And we're going to take this time. We have a few minutes for the sake of time. We have a few minutes to do a couple of questions. If anyone had any questions, we may not get a chance to answer all the questions today. If we don't, we do want you to leave your questions in the comment section, and we're going to make a question follow-up list on our website. So any questions that were not answered today, we'll be able to put those answers on our website that you can visit at a later time. Do we have time for questions, Lynette, or do we need to move on?
You know what, we have a couple of minutes. If anyone has a question, you can either put it in the chat box, or if you know how to use the feature online where you can raise your hand online and then I can call on you. We could take a few right now and then we'll go into the next segment, which will be our community partners. Thank you, Regina. That presentation was awesome and so informative, and you covered everything. And as you mentioned, it's all about us being educated and also going for screenings. Early detection is everything with the management and hopefully the process to make sure that we don't go into a different phase or stage of cancer if we do have it. Okay. Well,
as a time check, it's now 3:49, and so I think we should just go ahead into our community highlights.
Sure, that sounds good. Okay, next slide.
Having some difficulties.
Okay, so again, we are all in this to help each other, and it's about understanding and also spreading the information to help our community. And that's what helps to create a healthier community and just healthier generations. Next slide, please. So now we're going to hear from 2 of our community partners. The first one is Donna Lynn Schaefer. She's from Equal Hope Community Outreach Navigator, and it was formerly known as the Metropolitan Chicago Breast Cancer Task Force. We do have her information up on the screen. If you want, you can feel free to use your phone and take a photo of it, but we'll also have information posted on our Facebook page as well that will connect you. But if you want, you could just do a screenshot of this page. Donna Lynn, can you go ahead and give us a couple of minutes of overview for your organization?
Yes, ma'am. Thank you so very much. And hello to all of my friends on Zoom. Can you guys hear me good?
Hello. Yes, we hear you.
Hi, everybody. So, ladies, as Lynette said, my organization used to be the Metropolitan Chicago Breast Cancer Task Force. Some of you are very well aware of what we did. but we recently changed our name in November 2019 to Equal Hope. Now, Equal Hope's mission is to save women's lives by eliminating the disparities in Illinois. Originally through the lens of breast cancer, and now we have expanded to cervical cancer and other women's cancers, some of those that Regina talked about earlier during the presentation. So we address women's health holistically by helping women establish medical homes with the goal of eliminating inequities in preventions, screenings, diagnosis, treatment, and survivorship for all women. Now, Equal Hope's vision is to save women's lives by eliminating all of the disparities that we face simply because of our zip code. Just very quickly about our new programs at Equal Hope. Of course, we always have free, ladies, I said free screening mammograms for all women, insured, uninsured. If you're uninsured, we have community partners, but we will get you scheduled. We have free cervical cancer screenings now. Now, this newest program that we just started in June is our medical home placement, access to a regular doctor. Ladies, as Regina said before, it's so very important that we take care of our bodies. It's so very important that we're able to access doctors when we need them. So at Equal Hope, what we have done is we are partnered with FQHCs, which are federally qualified health centers around the city of Chicago. I'm just going to name a few. Family Christian Health out in the south suburb, Chicago Family Health on the southeast side, Esperanza on the southwest side. We also have Miles Square, Howard Brown, and I'm missing one. I just can't think of it right now. But those are just a few of the clinics that we have partnered with. And what we do is we help you establish a medical home at one of those clinics by paying for your initial visit. So when you go for your first visit at the clinic, we're going to pay for that visit. And then the clinic will assist the community in either signing up for Medicaid or Medicare, whichever one they qualify for, or seeing you on the sliding scale fee after that. So that's very important. I just want to put that out there because cancer don't go on pause because of a pandemic. So I want you ladies to know that we can and we will schedule you for all of your annual screenings. All you need to do is give us a call. And you know, my personal number, 312-942-1899. Give me a call and we'll get you scheduled at one of our clinics for your annual physical. Ladies, for cervical and breast cancer screenings, again, we have those with our community partners, Rush Park, Christ, Mercy. And I know everybody heard that Mercy is closing, but Mercy will be staying open for mammography and cervical cancer screening. All outpatient services are available at Mercy. We also have...
Donna Lynn, I'm sorry. We're on a tight schedule. And so we do want to end on time. And so, but we do have Donna Lynn's contact information. And if you could put your telephone number, your name in the chat box so they can write it down as well. For those who want to chat a little bit afterwards, the forum has officially closed. We'll be available for questions for a few minutes. Thank you.
Thank you, Donna Lynn. That was awesome. And I know that our community will definitely continue to benefit from your great services. Thank you. And if you could put...
Thank you, ladies, for the time.
You're welcome. And if you could put your telephone number that you provided in the chat box, and everybody will have that. Thank you. So now I want to go to... All right. Next slide, please, Dale. Now I want to introduce to our forum Mr. Jonah. I hope I pronounced it.
It's Serwinsky.
Okay, I was about to say that. And I am so pleased to have connected advocates for community wellness with Immerman Angels. And I will let Jonah describe their great efforts and also introduce you all to him and his organization.
Thank you. Yeah, and thank you for this wonderful presentation. So what we do is we connect individuals who have been affected by cancer with other individuals who've been through a similar circumstance for emotional support. So if you are someone who's been diagnosed with cancer, if you've been a caregiver to someone who's been diagnosed with cancer, or if you're a previvor, so you're someone who has been diagnosed with a genetic mutation that may make you more predisposition to cancer. So you might have cancer running in your family, and they've determined that you have a risk factor. You can call us and we'll connect. And what we do is you call us, we have a short screening with you, and then we connect you with someone else to talk to. They're not professional mental health, they're not licensed mental health professionals, but they are just other individuals who've been through a similar circumstance who will be there to talk to you through a really tough time, and just someone to talk to who's been through something similar as you.
Awesome.
So that's about it. Yeah.
And thank you so much, Jonah. For the contact information, you have your email right there. And again, Emmerman, they do have a lot of opportunities for volunteers as well, right?
Yes, and thank you for reminding. Yeah, and also, yeah, if you're someone who is looking to give back after you've been diagnosed with cancer, or you know someone in your family who has, please reach out to us too, and we'd love to have you volunteer with us to provide support to someone else. And it really depends on when you're available. You can let people know, you can set up your schedule, so it'll really work around your schedule. It's totally virtual. It'll just be over the phone or over email. So it's an opportunity to volunteer that makes it very amenable to your schedule.
Perfect. Thank you so much. And
thank you.
Yeah, and there's one other factor too with his organization is that it's international. Yep. So it has no boundaries for support.
Right. Thank you so much.
Thank you. All right. Take care.
So now we have our founder, Ms. Dale Kane, and executive director for this wonderful organization, Advocates for Community Wellness. So Dale, you could go ahead and give us our closing remarks.
Yes. Well, I want to thank everyone. Cancer is near and dear to my heart. I'm a survivor and overcomer, as well as my mother. What I do want to emphasize and what really is helpful, HEALTHFUL, is getting the screening done regularly, having an early detection, and then having support, both spiritually, emotionally, socially, and physical with your medical partners. I do want to let you know that this is a part of a series that we're doing called the Hardest Hit series. We're having our part 3. We'd like for you to save the date. The topic is going to be on managing chronic disease. This Thursday, September 24th, 3 to 4 p.m. And so we'd like for you to share that with your friends, families, and your social network. Ways to get involved with advocates. You can host a wellness program. You can host a workshop class series at your church organization. We come out into the community where you live, where you work, where you worship, and where you play. Also, you can support us by attending an event. Right now, you know, we're going virtual. We can't wait till we get to our in-person live forums. Also, you can volunteer with the organization, and we're always welcome donations because we are a nonprofit. No donation is too small. How you can connect with us, this is our telephone number. You can take a screenshot of this, our email to reach out to us, our website, and we'd like for you to like us on Facebook at A4CW. We want to thank you again for joining us. Remember, knowledge is power, and I'm going to add something to that. When you use it, we want you to share what you know. And thank you for sharing the time. And if anyone that didn't have an opportunity to ask a question, feel free. We can stay on for a few minutes. Otherwise, this concludes our session. And what we do in the community is education, health education and promotion to close that disparity, health disparity gap that's in America. So thank you for your support.